is Roxanne Jackson. I am the SSVF program manager since October of 2017, and our office is located in the Community Resource and Referral Center at 825 Dorcas Street in Omaha, Nebraska. SSVF is a federally funded grant and a program for eligible veterans. We focus right now mostly on rapid rehousing, which means a veteran must be literally homeless. So we offer case management, lots of wraparound services to help them get housed, and then carry on with case management after they're housed to make sure that they can sustain their housing. BVCA has 2 locations where there are case managers located to assist our veterans. Right here in Omaha, we have 2 case managers and myself, and we serve Douglas, Pottawatomie, and Sarpy counties. Then we have 1 case manager located at the home office in Fairbury, and she serves 15 other of the rural counties under our grant. It could be something as simple as losing a job, a divorce or a separation, an injury that leads to a disability or an existing disability, mental health, substance abuse, domestic violence. There are a lot of reasons that people become homeless. We have a really wonderful system in place right now that we have been really working hard at for a year, and that's our coordinated entry system. And that's where there are various agencies that we call or refer to as access points, and the CRRC is one of them. Most of the others are shelters. So whenever a person, whether they're a veteran or not, presents at any of these access centers, there's an assessment, a very brief assessment that is done, and that's when we identify our veterans. So if they are a veteran, they're tagged and they go on a separate list, and we pull from that list according to, usually the primary thing is their length of homelessness. That's how we're prioritizing right now, although we have some new things going into place to help with prioritization. So wherever they are assessed and then immediately referred to the list and then pulled as soon as we're able to take them. The Community Resource and Referral Center exists as what we call an access center. So in our coordinated entry system, anyone that walks through the door is going to get an assessment. And where that starts usually is with a HUD-VASH social worker. And if they're not eligible for HUD-VASH or a grant per diem program, then they bring them to us, and we verify whether or not they're eligible for SSVF, and then we make sure that they get on the list for housing in the SSVF program. But here at the CRRC, it's a one-stop shop as well. They can provide medical care here, social work. Twice a month they have pantry and other programs that come in with an opportunity for them to sign up for, like, say, SNAP or Medicaid, or if they're eligible to have their discharge status upgraded, there would be someone here that would help guide them down that path to get those things done. There's also a laundromat here, so anyone that's homeless in the community that needs to wash their clothes, the veterans could come in here and wash and dry their clothes free of charge. There's a room where they could sit and watch TV while they're doing that. And then right here attached to our building is the Victory Apartments, which is for veterans. So whenever there's an opening in there, if we have a veteran we can slide in there, they will go into the Victory Apartments. So it's really convenient. We often refer them to employment services, so there are several employment services in Omaha, including veteran-specific ones that we will refer them to. A lot of referrals to the Nebraska Department of Health and Human Services for things like SNAP benefits or energy assistance, Medicaid, Medicare. We work very closely with them. With HUD, we often do referrals or have them fill out applications for subsidized housing, so we work very closely with Douglas County Housing. General Assistance is another agency we utilize a lot. Medical, if they need medical services. And then there's a very wonderful program here that I absolutely love called Moving Vets Forward. and it is an organization that was founded and run by a veteran. And what he does is offers furniture and household goods free of charge to veterans, and they will deliver it right to their home. So that is a very valuable resource that we have here in Omaha. Well, with any relationship, you have to have trust. And I think veterans often are very proud and they're hesitant, more so than some of the other subpopulations, to reach out and ask for help. So we always do a first meeting before we get into all of the paperwork and all of that. It's just a one-on-one discussion, kind of let them tell their story. I think the key issue is listening first. People don't like to be talked at, and I think a lot of times we just get in the habit of repeating the same things over and over. So listening, let them tell their story, empathize with their story. So many of these veterans are so lonely. I mean, they're literally on their own, and loneliness leads to all kinds of other things. So it's building that trust, being available for them when they need us, meeting them where they're at on their path, letting them be the leaders of their own goals, and giving them the choice to go down that path, and then walking beside them, not in front of them.
I am Jennifer Cruz, and I'm the SSVF case coordinator, so it's a case manager for veterans here at Blue Valley, and I've been here since December of 2018. When I met her, she was at a shelter, and it was the Sienna Francis house. And when I finally contacted her over about a month later, she was there, and she was sitting in a corner in a wheelchair. And after questioning, completing the intake with her, I found out that she was a stroke victim. So she had aphasia, which affects the speech, so she had limited speech ability. So all of our communication, it takes about an hour to complete, maybe like a 15-minute ordeal, is through written and me guessing what she's gonna say. So I got her moved to a different shelter. It was a little bit more secure and safer for her there, and she's just really grown so much. She was unable to walk, she was wheelchair bound, and now she's like actually up and walking. We've taken her to appointments for shoe fittings and getting the extra support. She's able to clean tables for the shelter as a chore and things like that now. So really seeing the growth in the past 3 or 4 months has really been amazing. And then she's set actually next Monday on the 20th to come up on housing to get her housing packet for income-based housing. So she's been in a shelter since September of 2018, so it's really been a long time coming for her. And originally I thought, when I had this particular case, that it was going to be, I didn't know what to do. I thought she needed assisted living, a higher level of care, but then now seeing the growth that she's made in the months that I've had her, it's really, she'll be living independently with a little bit of assistance that'll come in and help her. So it's really been one that pulls at my heartstrings with her, but it's successful exiting. So I'll be sad when she exits, but I'm going to be celebrating that she's finally getting housed. So it's really been a good situation.